Hello everyone, this is Dr. Nori from Ginza Hikari Clinic in Tokyo, Japan. Today I'd like to share a real case that shows why you should never assume it's just Candida. Sometimes another infection is hiding underneath. Our patient was a woman in her 20s who works in the sex industry. She had a history of genital herpes and syphilis. For the past 2 or 3 days, she had experienced vaginal itching and a thick white discharge. During examination, we found a typical cottage cheese-like discharge, which is classic for Candida infection. She was given antifungal vaginal tablets and cream. However, when her test result came back 3 days later, both Candida and Chlamydia were positive. As you can see in the image on the left, the vaginal discharge was thick, white, and clumpy, a typical Candida presentation. The vaginal wall was slightly red and irritated, but there was no strong odor. These findings alone could easily make one think it was only a yeast infection. We performed a vaginal irrigation to wash away the excess discharge. The image on the right showed the appearance after cleansing. Here we have summarized the key clinical findings. Lab testing revealed Candida as expected, but also Chlamydia trachomatis. Other STIs such as gonorrhea and mycoplasma were negative. This confirmed the mixed infection, Candida and Chlamydia at the same time. We treated her with antifungal vaginal suppositories and cream, and prescribed oral antibiotics for Chlamydia. After 2 weeks, her symptoms had completely resolved, and both infections were cured on follow-up testing. This case reminds us that even if the clinical picture looks like typical Candida, another infection may coexist. STIs such as Chlamydia, gonorrhea, mycoplasma often cause few or no symptoms. That's why broad testing is essential, especially when one infection appears strongly. A hidden STI can easily be missed if you don't look for it. The patient said, "I thought it was just another Candida infection, but the test showed I also had Chlamydia. I was surprised, but after treatment, everything cleared up within 2 weeks." Vaginal itching or discharge can have multiple causes. Even if you are sure it's Candida, get tested for other STIs at Ginza Hikari Clinic. We offer STI testing, no insurance card needed, so foreigners and travelers can also visit easily. To summarize, this was a woman in her 20s with vaginal Candida infection who was also found to have Chlamydia. With proper testing and combined treatment, she recovered completely. The lesson here is clear. Always perform comprehensive STI testing, even when symptoms seem typical. Thank you for watching. If you found this video helpful, please like and subscribe for more real clinical cases and educational content from Ginza Hikari Clinic. See you next time.